coming in, I'm going to do my hand hygiene as they come in, and I'm going to say, hi, my name's Caroline. I'm going to be your nurse today. Can I have your first and last name and date of birth?
Wesley Stutz, 7/13/94.
Okay, just going to check your arm in. Alright, that matches what he stated. His appearance is clean, well groomed, he's tall, his body build is medium, his speech is clear, and his mood is content. Do you know where you are today?
Yeah, hospital.
Alright, do you know why you're here today?
Physical.
And do you know what time it is?
About 1.
Alright, patient is A&O ×4, person, place, time, and situation. I'm just going to ask you a couple questions. Are you having any chest pain?
No.
Any shortness of breath?
No.
Any recent weight gain?
No.
Are you, how often do you wake in the night to urinate?
Every once in a while. Once.
Okay. How many pills do you use to sleep at night?
None.
Do you or your family have a history of heart disease?
No.
All right, I'm just gonna take a listen to your heart real quick, okay? Actually, first, I'm gonna feel. So I'm gonna go for his aortic. I'm gonna set you up if that's okay. Are you comfortable? Okay. His aortic at a second intercostal space right side. His pulmonic second intercostal space left side. His Erb's point third intercostal space left side. His tricuspid fifth intercostal space lower sternum border, and his mitral fifth intercostal space lower sternum border. All right, I'm gonna feel for your apical pulse. Air apical impulse, and it is present 1 by 2 centimeters. I'm just gonna take a listen, all right? I'm gonna start on diaphragm side. Great, I'm gonna listen on my bell side. Flip it back around. I'm gonna check his apical pulse rate. I would listen for 60 seconds, and I'm gonna put it at 70 beats per minute. No murmurs noted, S1 and S2 present with a regular rhythm. Now I'm going to ask you some more questions. Do you have any sores or skin changes in your arms or legs?
No.
Any swelling or pain in your legs?
No.
Okay. I'm just gonna check your carotid real quick, okay? So I'm gonna check one side. Carotid pulse is normal, present bilaterally. Now, can I have you hold your breath for a second while I check? Oh, yeah, hold your breath. Okay, and no breathing noted. And can I have you tilt your head to the left? He's at 30 degrees, and then can I have you sit up straight for me? All right, no JVD noted. Take the seat back down. I'm just gonna check your pulses. First, I'm going to count your radial. Well, we'll just check your pulses real quick. Radial, ulnar, brachial, femoral, popliteal, posterior tibialis, and his dorsalis pedis. Okay, 2+ pulse strength, symmetrical, and regular rhythm bilaterally. I'm gonna check your radial pulse. I'm gonna feel for 60 seconds. I'm gonna say he has 70 beats per minute. All right. His skin color is consistent with genetic background. His turgor is good, it releases immediately. His skin texture is smooth, clear, no lesions noted. His lower extremity temperature is warm to the touch, normal, warm to the touch. And now I'm gonna check your hands. Your capillary refill is less than 3 seconds on the fingers. I'm gonna just take your sock off for a second here. Capillary refill on toes is less than 3 seconds. One side. Check your other side real quick. Oh, and I did clean my stethoscope off before I listened to him. And it is less than 3 seconds on the second toe. So capillary refill less than 3 seconds in fingers and toes bilaterally. Now I'm gonna check for edema in his shins, ankles, and tops of his toes. Sorry, I guess I am gonna have to remove your socks for this. Okay, no edema in shins, ankles, toes bilaterally. All right, now I'm just gonna ask you, I'm gonna do your lungs next. So, are you experiencing any shortness of breath or pain while breathing?
No.
Do you smoke?
No.
Do you have a history of lung disease or upper or lower respiratory infections?
No.
All right, I'm just gonna take a feel of it. Just breathe regularly for me for a moment. All right, can you have a sit up? Sit straight for me while I do this one. Thank you. His breathing is symmetric. He has symmetric chest expansion, no bulging or retractions. 2-to-1 anterior posterior ratio. I'm just gonna take a feel here, okay? Any tenderness with that?
No.
Okay. Just gonna check for crepitus. No crepitus noted. Can I have you sit up straight? Say 99 while I percuss.
99, 99, 99, 99.
Okay, tactile firmness noted. I'm just gonna have you take some deep relaxing breaths for me when I say, all right? Can you take a breath? Oh wait, let me percuss real quick. Sorry. All right, resonance noted in the lung fields. Now I'm gonna take a listen, and whenever I say, so just take a deep breath in through the nose, out through the mouth for me. Just relax. All right, take a deep breath for me. One more. Again. Again. More. Okay, one more. And one more. All right. Anterior lung sounds are clear, unlabored, and regular. Now I'll just have you sit up again and just take some regular breaths in for me. Shoulders are symmetric, posture is slightly sloped forward, probably due to sitting up. And take a deep breath in for me. All right, chest expansion is symmetric, bilaterally. And then again, just tell me if you feel any tenderness. Any tenderness?
No.
Okay, just gonna feel no crepitus noted, and then I'm gonna have you say 99 for me again, okay?
99, 99, 99, 99.
Okay, tactile firmness noted. And take another listen. And just take some deep breaths for me, okay? 1, 2, 3, 4, 5, and 6. Posterior lung sounds are clear, unlabored, and rhythmic. Okay, I didn't percuss, so let's percuss back here. All right, and lung sounds are present. I'm gonna have you go ahead and take a seat back for me. I'm gonna lay your bed down. At this point, I'm gonna conspicuously watch him breathing for 30 seconds. I'm gonna say he had 7 breaths per second, or 7 breaths within the 30 seconds, multiply it by 2, he had 14 respiration. His respiration rate was 14. Okay, so I'm gonna ask you some questions about your abdomen. Have you had any changes in your taste, or in appetite?
No.
Any difficulty swallowing?
No.
Any abdominal pain?
No.
When was your last bowel movement?
This morning.
Okay, any abdominal surgeries or history I should be aware of?
No.
All right. Before we begin, okay, he's flat. His contour is flat. No hernias noted. Just gonna lift your shirt up here. Thank you. No hernia noted. And do you have any tenderness or any masses that I need to be aware of in your abdomen? All right. I'm just gonna take a listen real quick, okay? Using the diaphragm side. Normal active bowel sounds in all 4 quadrants. And then I'm gonna go bell side and check for bruit. No brewing noted. Now I'm just gonna percuss your abdomen, okay? Tympani predominates in all 4 quadrants. I'm gonna go ahead and do a little superficial palpation. You said you had no tenderness, but let me know if you have any tenderness with this. Any tenderness? Okay, I'm gonna go a little deeper. This would be 4 to 5 centimeters deep. Okay, any tenderness with that?
No.
All right, no masses or tenderness upon palpation, no lesion, skin color is consistent with genetic background. And thank you. I believe we're done.